Well, I think that it hasn't changed the way that we diagnose or screen our patients because even with the HPV vaccine, which we're all very excited about having that option for something like this, it doesn't actually change the screening guidelines. So patients who have received the vaccine should still get the same exact screening. And really, the idea behind the vaccine is that we think that we will start to see the effects, meaning the decrease of cervical cancer rates, probably more like 10 to 20 years into the future as the vaccine gets to, as the natural history of HPV and cervix cancer is that lengthy. I think that it has changed that obviously the HPV vaccine is targeting younger women. Actually, ages 9 through 26 is what it is FDA approved for. They're two different vaccines, and that is what the studies have shown the most effective ability to mount an immune response with that age group. However, it has been studied in older women, ages 25 to 45. However, I don't think that all insurances don't necessarily cover that more standardly. So I think that's one of the biggest limitations.
And what do you tell patients about the HPV vaccine?
I tell patients that I do recommend the HPV vaccine in that age category. I do think that it is an important step and it's sort of an important tool that we have. It is not going to get rid of all cervical cancer, so patients who've had their vaccinations or patients whose kids have had their vaccinations, eventually those women will still need screening mechanisms because the HPV vaccines target two specific types of HPV, HPV 16 and 18, but there is thought to be about 20 to 30% of cervical cancer which is not caused by those HPV types. So I don't think that this is the answer to that will eliminate cervical cancer completely, but we definitely are in the right steps in terms of getting there.
Are there any risks associated with the vaccine?
I think that the risks are extremely low. I think most people say that the side effects are sort of soreness in the arm. We tend to watch patients in the office for about 20 to 30 minutes after the vaccination to make sure that they don't feel a little woozy or dizzy or anything else like that. There have been some very isolated cases of vaccine-related illnesses, but those have been statistically not very significant given how many vaccinations have been performed. So I do think that it's a safe vaccine and that we are recommending it as, as practitioners, and our different organizations such as our, societies are also recommending that as well.
Now, you mentioned that this might not be covered, but would you give the vaccine to this older age group of women?
I would offer that to those patients. Now, the vaccine, the way it has been tested and designed, it probably is more effective, and we know that it's more effective in women who have not been already exposed to HPV. So obviously in an older age group, you're going to have women who have been exposed through their lifetime with HPV. So we're not exactly sure of as if it would be as effective compared to a younger age cohort who has not been exposed to HPV. Though I do think that there are a lot of examples of women who may benefit from that. For example, patients who are having a new partner in their life, or they're were previously with someone and now they're entering into a different the dating scene or anything else like that. I think it's important to have women have protection against HPV infection, and so I think that that age group does have a large percentage of patients who may opt to choose to get the vaccine themselves.